One professional athlete is back out on the links thanks to a procedure. Let's see how it can actually do the same for us from Dr. Matthew Wilson with Western Neurosurgery. Doctor, thank you so much for coming in.
Thank you for having me.
Before we kind of get that tie in and kind of connect some dots with some stuff we've heard in the news, what is the procedure I'm talking about?
So what we're talking about is an anterior lumbar fusion. Many people know about neck surgeries that are done through the front of the neck. It is much less well known that we can do the same type of surgery in the lower back, depending on a person's symptoms and the reasons for doing it. But it's quite a successful operation and one that I enjoy doing quite a bit.
Well, you did hit on symptoms. What would be some of the symptoms somebody would have that this would work for?
They're pretty non-specific, so lower back pain is a very common one, probably the most common one. People that have had previous surgeries in particular can benefit from this. People that have back pain in association with leg pain or sciatica, you'll see sometimes written about. Those are the most common, and again, particularly for those people who've been operated on before, which is an increasing number of people as life goes forward. Those people benefit especially in comparison what the alternatives to it are.
And I think that actually is what I kind of alluded to at the beginning. That was the celebrity I was talking about is Tiger Woods, and that was actually his situation. He had had previous surgeries, and then this ended up being kind of the one that was the ticket.
That got him fixed, yeah. So it seems anyway. The approach to this operation is done through the abdomen, which I think is inherently somewhat scary to patients that I've talked to about it. Many of these people have had back surgery before, so they're familiar with the alternatives to it. But we don't have to cut through any muscles in making the approach. We simply push the contents of what you would think of as your belly out of the way and do it. And I have a vascular surgeon that does that, Dr. Chris Compton. The advantages to it, not cutting through muscle is particularly pain sparing for people. And one of the downsides to traditional back surgery, to doing a fusion through the back, is that you really are traumatizing the muscles around your spine, and that the pain that you experience afterwards and the length that you experience that pain is considerably more when you go through the back than it is when you're able to go through the abdomen.
So recovery time is another one of the benefits.
Yeah, I would say the average length of stay for this, depending on a patient's age, was 1 or 2 nights, which
really,
is probably half or maybe even less than compared to a traditional lower back operation. Much less blood loss. People that are on blood thinners for other medical conditions can restart them sooner. There are just a number of advantages to it that make it, I think, a great surgery for people. So
the model that you have in your hand, what is that of?
So this is just the very lower part of the spine, and what it shows is a device placed where the disc would be. So we approach the spine from the front, and we remove the disc from the space between the two vertebrae that we're operating on, and then we place in this case it's a piece of plastic with titanium spikes on it into that space, and what it does is literally jack up your disc, so that people that have very degenerative discs, we can restore both the height of that disc back to people. We can also restore the angle that we're often born with in trying to make the biomechanics of the way you move more like it used to be.
That is so amazing, all the advances and everything that we have available to us. If somebody wants to make an appointment to see if they're a good candidate for this, how do they do that?
So our office phone number is 520-881-8400, and the website is wnsaz.com.
And then we, of course, start there and start the journey and see if this is going to be something that'll we'll be able to benefit from. Doctor, thank you not only for coming here, but for explaining it in a way that was, very clear and easy to understand and what we could definitely take away from it. So thank you.
Thank you.
Absolutely. Let's give that information one more time. Western Neurosurgery is located at 6567 East Carondelet Drive. That's Suite 305. To learn more about anything that we just talked about, visit WNSAZ.com or call 520-881-8400.